This lecture is on contemporary philosopher Ryan T. Anderson and his book When Harry Became Sally, Responding to the Transgender Moment. Ryan Anderson discusses a shift in transgender ideology of transgender identity being at odds with physical sex to gender identity is the determinant of sex. He mentions the Human Rights Campaign website, which advises journalists to refrain from contrasting trans men and women with real or biological men and women, for this contrast is false. He references the American Psychological Association, which says that transgender means persons whose gender identity does not conform to that typically associated with the sex to which they were assigned at birth. Assigned at birth or imposed from outside is now favored because it makes room for gender identity as the real basis of a person's sex. He cites a guide for schools by transgender activist groups that says children develop a gender identity between the ages of 2 and 4. Parents and teachers should support these children by allowing them to live in a manner that supports their gender identity. He referenced PFLAG, formerly known as Parents, Family, and Friends of Lesbian and Gays, who say parents can know that a child is truly transgender because the insistent and persistent declaration of being a different gender is unique to kids who are transgender. Anderson asks, what do transgender activists actually mean when they claim that people who identify as the opposite sex really are the opposite sex? A popular claim about transgender people are they are trapped in the wrong body. But Anderson says it's a contradiction to say gender is a social construct while asserting a person can be trapped in the wrong body. For if a person's sex is just whatever that person happens to believe it to be, there is no such thing as an objectively real or truly male body or female body to inhabit. If a penis has nothing inherently to do with being male, and a vagina has nothing inherently to do with being female, there are no intrinsically male or female bodies to be trapped in. The American Psychological Association defines gender identity as a person's internal sense of being male, female, or something else. But Anderson asks, what does it mean to have an internal sense of gender? What does gender feel like? Apart from having a male body, what does it mean to feel like a man? What does it feel like to be a man, a woman, or neither? And why should feeling like a man make you a man? Feelings don't determine our height, weight, or race. Rachel Dolezal claimed to identify as a black woman, but clearly she is not. What about people who identify as animals or able-bodied people who identify as disabled? Do these self-professed identities determine reality? Should these people receive medical treatment to transform their bodies to accord with their minds? Many of the claims made by transgender activists seem to rely on stereotypes to determine what real men and women are like. If a particular boy tends to be more interested in stereotypical girl toys, we shouldn't jump to the false conclusion that he must be a girl trapped in a boy's body. We need to avoid the extremes of denying biological sex differences on the one hand and inflexible stereotypes on the other. Hormone therapy, changing one's gender expression in a social manner, and surgery to alter sex characteristics is often referred to as transitioning, but some transgender activists regard that term as inaccurate. It may seem like a change, but those who are transgender experience it as settling into themselves, or coming home to what they always have been inside. Activists believe that even small children have a real gender identity that may not align with their body, so they call for affirming gender identities in young children through social transition, followed by puberty blockers and cross-sex hormones. Anderson says good medical practice is rooted in promoting human well-being, not merely fulfilling a patient's desires. We flourish as human beings when we embrace the truth and live in accordance with it. A person may find some satisfaction in living out a falsehood, but that person will not be better off or fully flourish. We shouldn't medically affirm false assumptions to give temporary satisfaction to a patient, says Anderson. An example of medically affirming false assumptions would be performing an amputation on a person with bodily integrity disorder. This might alleviate the emotional distress temporarily, but would do nothing to resolve the underlying psychological problem. Likewise, someone who has gender dysphoria and has surgery to alter sex characteristics may alleviate some emotional stress temporarily, but this does nothing to resolve the underlying psychological problem. Anderson says someone who becomes subject to a delusion may at first be harboring feelings not in line with reality, but over time, these feelings generate an alternative reality in their mind. Anderson uses an analogy with anorexia. Some may feel they are overweight, but know they are not. They struggle with these mistaken feelings until the feelings overwhelm them and come to believe they actually are fat. Likewise, some people with gender dysphoria feel as if they were the opposite sex, but know they are not. So they struggle with these feelings until the feelings overwhelm them and they come to identify as the opposite sex. There are those who wish to accept their bodily self and understand their gender dysphoria is an illness. They don't wish to transition. They wish to receive help in identifying with and accepting their bodily self. The activists don't speak for everyone. The case for transitioning seems to rest with an assumption that a man can be trapped in a woman's body and vice versa. Thus, the activists say adjusting the person's hormone balance and restructuring the anatomy with the inner sense of identity should make things right. But is there any biological basis to believe that a man can be born in the body of a female? Is there reason to believe that hormones and surgery can reassign sex? So what are males and females? Anderson says sex, in terms of male and female, is identified by the organization of the organism for sexual reproduction. Males are organized to engage in sexual acts that donate genetic material, while females are organized to engage in sexual acts that receive genetic material and then carry the resulting offspring. Sex is understood this way across species. Farmers and breeders rely on this distinction for their livelihood. Only recently, and only within the human species, has this become controversial. Scientists who wrote embryology textbooks had no difficulty pronouncing when and how sex is determined. The male sex is determined by the presence of a Y chromosome, while the female sex is determined by the absence of a Y chromosome. Which sex you are has biological development implications. Sexual differentiation begins at conception, progressing in the womb, and continues throughout life, notably at puberty, but also significantly at menopause in females. Male and female bodies differ not only in their sex chromosomes and in their organization for reproduction, but also when it comes, on average, to size, shape, bone length and density, fat distribution, musculature, and various organs, especially the brain. There is much overlap between men and women, and while environmental factors are likely to influence many of these differences, there's no denying the role of biology. Which sex you are has biological implications for perception and behavior. On average, there are differences in the brains of males and females and how they experience emotion and pain, see and hear, and how they remember and navigate. Newborn male and newborn female babies respond to objects and people differently. Girls tend to show more interest in mothers than boys do. Girls tend to prefer movies showing faces, while boys tend to prefer movies showing cars. Since they're newborns, it's difficult to blame socialization for the differences. In play, boys tend to favor balls, while girls favor dolls. Females tend to display more verbal ability in general, and to recover verbal skills better after suffering a stroke. Men tend to be more conceptual and more focused on action, as the studies with newborn babies shows. Sex differentiation is vitally important for good medical practice. Male and female bodies tend to be susceptible to certain diseases in different ways and respond to treatments differently. These biological differences seem to also have consequences for mental health. Men are more susceptible to autism, attention deficit disorder, conduct disorder, specific language impairment, Tourette syndrome, and dyslexia. Women are more susceptible to depression, anxiety disorder, and anorexia. Men are able to synthesize serotonin, the neurotransmitter commonly associated with pleasant moods, at a greater rate than women, so are at a lower incidence of negative emotion. Men and women also tend to respond differently to pain, which has important implications for the use of painkillers and other medicines. Differences in the chemistry and structure of the brain influences our response to stressful events and how we remember them. This has implications for treating post-traumatic stress disorder. Anderson says sex reassignment surgery does not really change your sex. He says sex is properly understood as the organism's organization for reproduction. This cannot be changed. All that has been done in sex reassignment surgery is acquire the outward appearance of a change in bodily organization. Transgender activists have tried to make a case that transgender identity has a biological basis in the brain. Those who identify as transgender tend to have similar brain structure as the sex they identify with. Much of the evidence in support of biological basis for gender identity, based on the way the brain functions, is founded on comparison studies of the brains of transgender persons. But Anderson says if an individual has been self-presenting as the opposite sex for years, that behavior may have produced changes in the brain that differentiate it from the brains of other people of the same biological sex. Anderson also says that even if there is a biological basis for people to believe they are the opposite sex, that doesn't make it so. Anderson says transgender affirmative policies may prevent some gender-confused children from coming to accept their true sex. He cites that 80 to 95% of children who say that they are transgender naturally come to accept their true sex and to enjoy emotional health by late adolescence. Affirming young children a transgender identity may prolong and solidify their dysphoria when they might otherwise have come to accept their bodies as they matured. Instead, they may end up attempting to change their sex through surgery. Trans-affirming clinicians, moreover, are confident they can accurately identify which kids are really transgender and not just going through a phase. But Anderson says there is no reliable scientific evidence to support the view that professionals can actually know whether a child will persist in transgender identity into adulthood. There are no laws in the U.S. prohibiting the use of puberty blockers or cross-sex hormones for children or regulating the age they can be administered. Children with gender dysphoria may have anxieties about the expectations they believe are attached to their given sex. Like patients with anorexia, these children mistakenly believe a drastic change to their body will solve or minimize their problem. A sensitive temperament might predispose a boy to identify with girls, but the remedy is not to tell him he is actually a girl, dress him like a girl, give him a feminine name, and eventually put him on puberty blockers and cross-sex hormones. An effective therapy is to tell him that it's perfectly normal for a boy to be sensitive. Sexual development disorders are injuries to the development of the male or female body. They're frequently caused by chromosomal or hormonal defects or genetic mutations. Some examples of sexual development disorders would be ambiguous external genitalia, incomplete development of reproductive organs, or formation of two sets of sex organs. Anderson says people with sexual development disorders do not constitute a third sex. They are either male or female, but with a disorder in their development. He says the sound medical advice is to identify the predominant underlying sex and then take measure to provide health and functioning as far as possible through hormones and possible surgery. Disorders of sexual development have little, if anything, to do with transgenderism, says Anderson. Most people with sexual development disorders do not identify as transgender. Most people who do identify as transgender do not have a sexual development disorder. Anderson goes on in his book to talk about how the Obama administration worked to redefine sex to mean gender identity. The Obama administration pushed gender identity policies as a matter of civil rights in various domains: education, healthcare, housing, and the military. In September of 2016, the Department of Housing and Urban Development required shelters for the homeless and for battered women, among others, to allow access based on gender identity. The military paid for sex reassignment surgery for convicted spies. Bradley Manning, who was sentenced to 35 years in prison for leaking classified information, announced himself as Chelsea Manning. Taxpayers had to pay for those sex reassignment procedures. Anderson talks about the movement for Title IX to be interpreted to support transgenderism. In 1972, Title IX was a federal law originally passed to protect women and girls from harassment and discrimination and ensure equal opportunities in education. Now Title IX is being used to support transgenderism. On May 13, 2016, the Departments of Justice and Education sent a Dear Colleague letter to the nation's schools setting forth policy on gender identity. The press release announced schools must allow students to participate in sex-segregated activities and access sex-segregated facilities consistent with their gender identity. Federal agencies would now treat a student's gender identity as the student's sex for purposes of enforcing Title IX. The guidelines forbid schools from requiring documentary evidence of a student's gender identity. This means schools must allow boys access to girls' bathrooms, locker rooms, dorm rooms, hotel rooms, and shower facilities as long as they claim to identify as a girl. Anything less than full access to the sex-specific intimate facility of one's choice is deemed a transphobic denial of civil rights and equality. Anderson says when Title IX was passed, no one thought sex meant however one chooses to identify as a gender, and that this redefining of gender is contrary to Title IX's original purpose. Our laws have long reflected the common sense view that sex-specific intimate facilities are not discriminatory. Title IX is thus being used to violate the privacy, safety, and equality of women and girls. According to the Obama administration, a school may not require a transgender student to use facilities inconsistent with their gender identity or use single occupancy facilities when other students are not required to do so. When it comes to campus housing or hotels during off-campus trips, a school must allow transgender students to access housing consistent with their gender identity and may not require transgender students to stay in single occupancy accommodations. The school may not require transgender students to have a medical diagnosis, undergo any medical treatment, or produce a birth certificate or any other identification before accommodating with their gender identity. The document Schools in Transition, a guide for supporting transgender students in K-12 schools, was jointly produced by the American Civil Liberties Union, the Human Rights Campaign, Gender Spectrum, the National Center for Lesbian Rights, and the National Educational Association. The document endorses the view that transgender identities are healthy and normal aspects of human development, that children should be encouraged to act in ways consistent with their self-identification, whatever that happens to be. Any attempt to encourage a child to affirm a gender identity contrary to the one they hold is unethical and likely to cause significant emotional harm. The document says any tomfoolery where a boy will claim to be a girl just to get into the girl's locker room would be easily discernible. The document says a student's transgender status, legal name, or sex assigned at birth is confidential. Other students, as well as their parents, may not be told they will be sharing a bathroom, locker room, shower, dorm room, or hotel room with a student who identifies as transgender. So girls will have no advance notice the boy who identifies as a girl, but has all the standard male body parts, will be undressing in their locker room or shower or spend the night in their hotel room. Any student who feels uncomfortable sharing facilities with a transgender student should be allowed to use another more private facility like the bathroom in the nurse's office, but a transgender student should never be forced to use alternative facilities to make other students more comfortable. Regarding trans boys on girls' sports teams, the guidelines say, concerns regarding competitive advantage are unfounded and often grounded in sex stereotypes about the differences in abilities of males versus females. But Anderson asks, suppose a student identifies as a boy on Mondays, Wednesdays, and Fridays, but is a girl on Tuesdays, Thursdays, and Saturdays, and is both on Sundays. Which student team should this person play on in the weekend tournament? Anderson goes on to talk about school lawsuits pertaining to transgenderism in his book. In May 2016, A public school district in Oregon paid a $60,000 settlement to a teacher in response to a formal complaint about colleagues' refusal to refer to the teacher as they. The teacher, Leo Sol, does not identify as male or female, but rather transmasculine and genderqueer, or androgynous. In the complaint, Sol says that other teachers had engaged in harassment, in part by refusing to call me by my correct name and gender to me or among themselves. A public charter school in Minnesota, Noble Classical Academy, became roiled with controversy in late 2015 after administrators informed parents that an incoming kindergartner was gender nonconforming and that the school would be supporting the child's gender identity. As part of the program, all K-5 students would read My Princess Boy, a book about a boy who expresses his true self by dressing up and enjoying traditional girl things. NOVA's board of directors approved a new gender inclusion policy, allowing students to choose their own gender at will. The school would work together with any student who identifies as transgender to create a tailored gender transition plan. Students could demand to be addressed by a preferred name and pronoun, and would be entitled to use bathrooms and locker rooms for the opposite sex, as well as sleeping facilities on overnight trips. But still, the child's parents filed a complaint and later a lawsuit against the school, alleging it had not adequately protected their 5-year-old from gender-based bullying and hostility. They faulted the school for allowing parents the choice to opt their children out of transgender instruction. The state of North Carolina was sued by the Justice Department under the Obama administration in May 2016 over the state's law under which access to bathrooms, locker rooms, and other sex-specific facilities in public schools and other government buildings is to be determined by biological sex as indicated on a birth certificate. This North Carolina law allows local school authorities and managers of government offices to provide special arrangements for people who identify as transgender, such as single occupancy bathrooms. Anderson says such measures would protect women and girls from finding biological males in places where they expect some privacy, while also granting people who identify as transgender a safe space. In announcing the lawsuit against the state of North Carolina, the Attorney General, Loretta Lynch, suggested that basing bathroom and locker room access on biological sex was as repulsive as basing it off of skin color. Anderson says, whereas our skin color is irrelevant to which bathroom or locker room we use, our bodily differences as male and female are precisely why we have men's rooms and women's rooms. Sex-specific facilities exist in order to provide bodily privacy. Anderson points out that in the past, courts have defended the bodily privacy of people in a variety of settings, including prisons. The Fourth Circuit Court of Appeals has ruled that prisoners have a right not to be seen in a state of undress by guards of the opposite sex unless there is an emergency. Anderson says it's entirely reasonable to not want to see or be seen by persons of the opposite sex in a state of undress, even if they identify as the same sex. Anderson says the privacy concern is particularly heightened for children and for adolescents as they go through puberty. There are women who have been victims of sexual abuse, and seeing a naked male body can be a traumatic trigger. Whether the naked male body they see belongs to a man who identifies as a woman is of no relevance in the moment to survivors of sexual abuse. Sex-specific intimate facilities serve the related purpose of protecting girls and women from male predators. Anderson says the concern isn't that people who identify as transgender will engage in inappropriate acts, but that predators will abuse gender identity politics to gain easier access to victims. Tim Hutchison, retired sheriff of Knox County, Tennessee, says public restrooms are crime attractors and have long been well known as areas in which offenders seek out victims in a planned and deliberate way. This was true before access to restrooms and dressing rooms was based on gender identity, and these new policies create more safety risks for women and children. Hutchison says criminal incidents enabled by gender identity access policies are already occurring. Prosecution of some sex-based crimes depends on establishing criminal intent. This is harder to do if biological males have a legal right to be in women's restrooms and changing rooms. Predators can use the cover of gender identity-based conventions to engage in peeping, indecent exposure, and other offenses and behaviors. Law enforcement officers may hold back from pursuing investigations of peeping or indecent exposure in bathrooms or locker rooms for fear of opening themselves up to charges of discrimination. The prospect of being accused of bigotry or discrimination can also make women more hesitant to report certain forms of sexual misconduct, such as peeping or indecent exposure. Hutchison predicts that the number of sex crimes in public facilities will increase while the reporting of those offenses decreases. Anderson stresses the importance of dialogue when it comes to equality in sports. He says there are bodily differences between men and women that can raise questions of fairness in competitive athletics. The NCAA stipulates that a man who identifies as a woman may compete on a women's team only if the athlete obtains a doctor's certification of the subject's intention to transition to a woman, that hormone therapy has actually begun. The International Olympic Committee requires men who identify as women to demonstrate that their testosterone level has been below a certain cutoff point for at least a year before their first competition. Anderson says these rules are an effort to make reasonable accommodations for people who identify as transgender, allowing them a chance to compete in athletics without forcing biological girls to compete on an uneven playing field against biological males or against biological girls who are taking male hormones. Anderson mentions the issue of the government getting involved to ensure that people refer to transgender persons by their preferred pronoun. In New York City, you can now be fined up to $250,000 for intentionally misgendering someone by using pronouns other than those the person prefers. In October 2017, the governor of California signed a new law that could send healthcare workers to jail for failing to use a person's chosen pronoun.